Good morning. Thank you for joining us for our coffee conversations here at Forge Breast Cancer Survivor Center. We have the Dr. Elkhanany back with us today to talk about breast cancer myths. This topic can probably go for a really long time, so we're hoping that we can embody a good bulk of it during this coffee conversation today. So, Dr. Elkhanany, could you remind us a little bit about you and the work that you do?
Yeah, absolutely. Thank you for having me here again. It's really exciting to be here and talk to the beautiful group of folks that support Forge. I'm a medical oncologist. I finished my med school in 2011 and done my residency and fellowship training, specialized cancer training in Kansas City, then in Buffalo, New York, in Roswell Park, and then I started at UAB going on 3+ years now. GAB Cancer Center is a specialized cancer center. So each oncologist here sees a particular disease type. So I've been privileged to see breast cancer. This is what I do day in, day out. Along the specialization comes, some other responsibilities for research activities. So most of our time is dedicated for research, specifically clinical trials, as well as research in certain subtypes, such as triple-negative breast cancer, trying to find new and novel ways of managing these types of cancers.
Well, thank you so much. It's been a joy to know you, and all of your clients that come to us, they speak really well of you. So just very happy to have this connection. And I'm so thankful that you've taken the time to talk with us today about breast cancer myths, because myths it can sound so believable sometimes, right? Something that like my grandmother told me, my mother told me, and whoever, and especially when it comes to our health. And so I really think this is an important topic. I think that this will be really helpful for somebody who might think something's a fact, but in actual reality, it's not necessarily true. So in knowing that, how often would you say that breast cancer myths are confused with facts?
I would say quite often. And big part of that has to do with how common breast cancer is. And a lot of people come with very different experiences, and they will funnel into the breast cancer cone. And because of that, sometimes associations can happen, or anecdotal evidence, which is, I heard this story from that person and that story. And part of it is that people want to grasp on anything that can help them, even if that help can be small, or sometimes even non-existent. So because of that, there's a lot of a lot of facts and a lot of myth that lie around, and the line between them are actually it's quite thin, matter of fact. So I think it's always important to take the time, research anything that anybody says. In fact, when I see my patient, I always tell them, be wary of the unsolicited advice. It's always unsolicited. And it is true that everybody wants to share their experience in good faith, but many a times things don't translate as well when it comes to real world.
You're right. I love that you said unsolicited, because you can go and say, "Oh, I went to the doctor. Listen, the doctor didn't know what he's talking about. Let me tell you what my grandma told me about." So it always seems to come that way. And in knowing, that we're going to get this unsolicited advice, or we're going to see things on the internet, like Google and Facebook are your new Dr. Googles, right? And so. I kind of want to discuss some of those misconceptions. One of those things that some might, be a little uncomfortable with, but, changing your diet, such as eating healthy, avoiding alcohol, avoiding sugars, exercising regularly or rigorously. Those are some things that will protect you from breast cancer. So you won't get it if you're doing these things. Is that a fact, or is that a myth?
Right. So that is a myth. So there are healthy lifestyle options, and they're always very well regarded, which some of them you mentioned. So eating healthy, avoiding alcohol, sugars everywhere, minimizing sugar, regular exercise and physical activity. These are all great things, and these will lower the risk of development of breast cancer, but they will not eliminate it. Breast cancer, well, cancers really are very complex. It's like the body got into an error. There's an error in the body, and there's always multitude of reasons why that happens. Living a healthy lifestyle will lower the risk of development of breast cancer. Unfortunately, cannot eliminate it. And because of this, I always highlight to patients that, what you've done, when you choose to live healthy, that is absolutely the right thing to do. This is not you, this is not your fault for not doing enough. It's just, unfortunately, cancer is just sneaky.
Yeah, I think for people who, so at some individuals who get diagnosed, they think about, what did I do to cause this, or what did I not do?
Not do, right? Yeah. And most of the time, they done way more than they need to do, honestly. And they do a great job. But yeah.
Yeah. And so another question that I have about a breast cancer fact or myth, one that came up was deodorant. Do certain deodorants cause or increase your chances for breast cancer?
So this is actually one of the things that I think is quite interesting, because so the short answer is no. All right, but I think a lot of these myth that goes into why people think of think of some theoretically appears makes sense that deodorants have some chemicals. You put them in there. There's these lymph supplies that can go retrograde and affecting the breast tissue. In fact, there has been some studies that few of the materials that you can find in certain deodorants, aluminum, for example, they can actually be found in breast tissue. Again, there is no link, however, that actually translates to an increased risk of breast cancer. So, deodorants are safe to use, unless otherwise.
Okay. Well, that's good to know, because as somebody who doesn't like to be musty, I would like to know that what I'm doing to prevent that from happening doesn't give me breast cancer, right? So, and kind of still leaning into that, as it relates to bras, that was another question that came up. Do individuals who wear braless or wired bras, is there a difference? Is there a link to breast cancer as to what type of bra that a woman wears?
Yeah, all good questions today. So, so again, that's one of the I would say older myth, about that some of the bras, especially the ones with an underwire, that they have a theoretical risk of bringing breast cancer because they block lymphatic drainage. Again, sounds really reasonable on paper, but in the real world, it actually panned out to be nothing. In fact, there is a research that was done about maybe about close to 10 years ago now, over 1,500 patients, and when they all used these underwire bras, and there was no increased risk of developing breast cancer. So again, no.
It's always nice to have a study, right, to confirm.
Yeah.
So if somebody has a family history of breast cancer, will they have it? Or vice versa, if they don't have breast cancer in their family, would they not have it? Does that matter? Does your family history have a definite predetermined decision on if you're going to be diagnosed with it or not?
Yeah, so that's a great question. I think this goes into the complications or the complexity of what's called hereditary cancers, and the difference between a cancer being hereditary and a cancer being caused by genetics. So we all have genes in our body, and these genes, are inherited from our parents. Now, our own genes can become bad. So that on their own, and we call that genetic factors. Or we could have inherited these bad genes from our parents. So that would be hereditary. So, it's important to know, that some cancers can be hereditary, like breast cancer, and other cancers can just be genetic, that popped up in the body without having any family history. Now, breast cancer can be both, matter of fact. So there is a component of breast cancer that is hereditary. So about 1 in 10 patients will have cancer that quote unquote runs in the family, or some sort of genes that were passed down to her. That's 1 in 10 patients with breast cancer. The other 9 out of 10, it's just genetic. There is something in their body, not in their family, that actually ended up causing cancer to develop. And this is important because that doesn't really mean that if you don't, so if you do not have a family history of breast cancer, you can still develop it. As I said, that's actually the majority. If you do have a family history of breast cancer, you're likely a little bit of a higher risk than those who didn't, but still the odds are we have to it's a high risk, and not everybody will end up developing it. Even the most notorious gene out there, which is called BRCA gene, patients who have BRCA gene, the risk of developing breast cancer is pretty high, about 80%. That means even 20% might not get it. So it's important, however, to get these tests to estimate the risk of one person's risk of developing breast cancer. There is, there are models out there. If somebody is concerned about their breast cancer risk, they can talk with their primary care doctor. There's the Gale model and the IBIS model. Gale and IBIS take some personal factors as well as family factors and guesstimate the risk of developing breast cancer. And based on that risk, people can actually do actions if that number is high.
That's so great. Like, I didn't know any of that you just said. Like, I love that you wrote down the difference with it being hereditary and being genetic, because it's really easy to assume that, my mother had it, my grandmother had it, my aunts had it, I'll have it, and then, hey, sometimes it just pops up in your body. You don't have to have that family history, and just knowing what that means. So thank you for breaking that down. I really appreciate that. So another one, kind of just goes a little off to the side, I guess, but it's just, we're already talking about genetics and we're talking about parents. Can you kind of speak to the fact that there's a myth that men don't get breast cancer, like that it doesn't necessarily impact them? Can you kind of tell us if that's fact or myth, and kind of give us a little bit of the details on it?
Yeah. So that's a small niche, but men, unlikely to get breast cancer, but they can get it. Out of 100 breast cancer cases, 99 would be female and 1 would be a male breast cancer. So it's 1 in 100. The breast cancer in males tend to be typically what we call hormone dependent, usually genetic or hereditary in nature. In fact, the panel, the NCCN guidelines, where we look for the patients who might benefit from genetic testing. We all agree that for men who develop breast cancer, they need to get tested, no matter what type, what age, because there's a big hereditary component in there. So what that means that if there is a patient that I see in the clinic who had a family history of breast cancer, her risk is high, we do the genetic test, she has BRCA gene, and she has 3 boys. I tell her, well, your boys still need to get tested because that can increase the risk of breast cancer. And obviously, there's also some other cancers associated with some of these genes that we also need to test for example, prostate cancer. And a lot of my patients don't know that BRCA gene in men can increase the risk of prostate cancer. In fact, it's pretty well documented relationship. So yeah, the challenge in men who get breast cancer that there's just not that many, and therefore taking care of them gets fairly complicated because of the type of treatments that we use. It's usually recommended that they seek care at a center that have experience in treating men with breast cancer.
Thank you. I'm glad. I'm hoping that number continues to decrease, right? Especially, for women, because we're the 1 in 8, but, for men with the 1 in 100, hopefully we can continue to kind of decrease the probability. And so another question that we have listed, if you do your mammogram every year, there's a guarantee that the cancer will be picked up early.
Right. So now this is, I would say, a pretty common misconception, unfortunately, about the power of the mammogram or the limitations. Mammogram is essentially an X-ray, right? And we all know X-rays are good, but they're not great. There has been a series of studies that test the limit of the mammograms, what we call false negative. When we have a new test, we always want to make sure we understand what's called false negative and false positive. Now, false positive is when the test calls something that turns out not there, right? So it's a positive, but it's false. False negative is when the test doesn't call out something, but in reality it's there. So, for example, in our case would be cancer. So the mammograms have partially up to 20% false negative rate. That means that 4 out of 5, it will call cancer that I see cancer, and 1 out of 5, it will not call it cancer. It might call it something else, might not even see it altogether. And this number actually is an average. Some other cancers are more notorious than others of being able to miss through mammograms. For example, what's called invasive lobular cancer, which doesn't grow in like balls of cancer, but grows in sheets. The dense breast tissue is one of the things that mammograms, again, as an X-ray, cannot go all the way through, and dense breast can hide certain cancers. I'm not trying to scare people that mammograms are, but I'm trying to put things into perspective. Mammograms are good, they're not ideal, and that's why you will always see us talk about self-breast exams, talking with your primary care, being what we call breast aware. That is being, just like anything in your body, if there's something different, you want to put it up to your healthcare provider.
Yeah, thank you. I never thought of mammograms as necessarily being an X-ray, so because I'm not at the age where I'm getting them yet. But that is kind of good to know. Like there's still like you got your mammogram and everything looks good, but it's still important to make sure that you're aware of what's going on with your body just in case, because there is that chance that something might have been missed. So leaning into self-breast exams, if you feel any lumps in your breast, does that mean that you have breast cancer?
Oh, no, that's the big. So the short answer is no. There's all kinds of lumps in the breast, and all kinds of when we do the mammogram and ultrasound, they have all of these kind of different shapes. In fact, I would say the majority, approximately up to 90% of these lumps are nothing. Can be what's called fibroadenoma or fibroglandular tissue, or even some of these more benign conditions like hyperplasia and other conditions that needs monitoring, like atypical hyperplasia, like ductal and lobular. All of these would have these sort of bumpy feel in the breast, and a lot of times it's very defined, meaning it's something that you can feel what it starts with, and it's kind of like, think of like a soft rounded ball, movable and stuff like that. So many lumps are actually not breast cancer, and therefore many of the biopsies we do are negative biopsies. But it is part of this, actually complement what I just said before, that it is part of being self-aware. Between doing mammograms, doing self-exam, and being able to talk to your provider, that's how we kind of just close the triangle of missing something in between these three. And many of these lumps can be easily categorized by mammograms, either good or so-so, or we definitely need a biopsy kind of triage.
So say somebody's biopsy does come back, and they are positive for breast cancer. Is it fact or myth that all breast cancer treatments, start the same? Like, hey, I found out I have breast cancer, I need to start chemo, or I need to, are all treatment regimens the same?
Right. So this is a very important misconception, okay, that all breast cancers are treated the same. That gets me to my what I just mentioned at the beginning about unsolicited advice, because every person thinks that their story, what they have gotten through is the way to go. And then they will tell you, oh, you didn't do that, or you didn't have that, or you didn't have that. So the answer is breast cancer is so diverse, so complex, and there are at least, on paper, there are at least 3 main types with up to about 20 different subtypes of breast cancer. And these all determine, what treatments are needed and in what succession and in which sequence. They're broadly divided into hormone-driven and what's called HER2-driven and triple-negative breast cancers. But underneath those, even under the genetic level, they have much more diversity. So when we develop a plan of care for breast cancer, you want to address the person in front of you, not just the cancer itself. So, you want to be, patient needs to be having a holistic evaluation, meaning what's their medical history? What is their social situation? What kind of support do they have? How are they doing overall when it comes to their day-to-day activity? What kind of job do they have? And then you start going into what is the stage of the cancer we're dealing with. Stage 1, 2, and 3 are treated very differently. And stage 0 has its own management options. And after that, you look at the type that I was just referring to. What is the main type? What is the subtype of breast cancer? You factor all that in with one big goggle of what do patients need? What do they prefer? I think it's very important to remember at the end of the day that, and I told that to all my patients, that it's big part of cancer that it robbed people from their ability to choose. It did, and it came out of nowhere. So what I try to do when we us as oncologists is try to put that ability back to patients and tell them, here are our treatment options. This is what we can do. This option will get us there. If we don't do it, that's what's going to get us there, and factor in all these factors. So because of this, the pathways to treatment in breast cancer are numerous. And when I talk to my trainees and the fellows and that we train, I tell them, your biggest misconception that when you try to approach breast cancer is to think that they are one disease.
There's no one size fits all.
Absolutely. And I have many patients that I ask them, you told me that your friend is so-and-so, your cancer, same stage, same type, but do you think that you had different paths in your care? And she said, absolutely. And there's all these kind of experiences that I've heard.
Before we move into another question, I see a question in the chat that was asking about breast size. Does breast size, the bigger your breast, the higher your chance of developing breast cancer?
Breast size, you said? So breast size is not associated with increased risk of breast cancer. Breast density is, and a lot of the modifiable, a lot of non-modifiable non-modifiable factors that can lead to increased breast cancer would be breast density. Also occasionally it has to do with breastfeeding or not. Breastfeeding has some there's some thoughts that it can slightly increase the risk of breast cancer. It's very interesting, but this is a temporary increase typically during the feeding period, and usually people have to have a higher risk for breast cancer for that to develop. But the size alone doesn't really increase the risk of breast cancer.
Thank you. So when someone is done with their active treatment, are they done with breast cancer? Is it all over? Like, I've done my treatment, I've done my chemo, I'm good. Like, are they done with this in their lives after they've done their active treatment?
Yeah. So the short answer is not quite. Once treatment is over with breast cancer, that's the active treatment phase is complete. The the patients typically go over what's called, survivorship stage. Survivorship stage is when it's that middle ground between seeing your oncologist versus seeing a primary care doctor, that can, and the survivorship stage is somewhere in between. And, because breast cancer patients get cured, but their risk of cancer or developing a new breast cancer is still there. That's why we recommend continuing with the mammograms after the breast cancer diagnosis. And then there's always a very small but real risk that the original cancer can come back later on, years down the line. So because of that, we want a person, not necessarily an oncologist, that is able to, tune to patients' symptoms and make sure that they're doing fine. And that's where the concept of survivorship emerged. We have survivorship clinic at GAB. There is a lot of places now that are opening up breast survivorship clinics. And that's when it comes to what medical care. Another part is the lifestyle modification that we said earlier are something that patients can do for sure after the diagnosis of breast cancer. So continue to exercise regularly, avoiding alcohol, and keeping the body mass index low have been associated with decreased risk of breast cancer recurrence. So they both decrease breast cancer from happening and they decrease it from coming back. And these are factors that patients can do to help decrease breast cancer.
Okay. Thank you. So as we're learning all of these things, like, what's fact, what's a misconception, what's a myth? Say somebody doesn't have this resource that we have, right? They can't, join a coffee conversation or whatever. They don't really have, a support system that they feel comfortable leaning into to find out if these things are true or if they're not. And sometimes people are just uncomfortable talking about it and they rather just look for themselves. What are some ways that someone can get clarity and credible clarity at that about these misconceptions or myths, and just kind of decide from there where they want to go with their treatment and their care?
So I think there are a few credible sources that are present online. This is one of these that you'll find so many resources, it's hard to know which one is good and which one is, serving a specific purpose. You'll find some resources, for example, breast cancer, the breastcancer.org, also American Cancer Society. And my favorite is the NCCN patient guidelines, or guidebook. So the NCCN is the National Comprehensive Cancer Network. When we talk about cancer guidelines, that's what the NCCN guidelines are, and that's how we all treat breast cancer. And they make resources for patients, and these are fantastic sets. So usually it's like a handbook, like 150 pages actually for stage 1, 2, and 3. And I can link that actually in the chat since we're doing virtual. That way people can just check it. So this is one of the resources that I recommend. But if patients do come up with an article or something or a question, it's always better to just throw it at your oncologist. Just send it to your oncologist. Say, I heard that, I read that. Especially in the things that might be a little bit harder to find guidelines on. For example, herbal supplements, vitamins, what kind of food to avoid. These are areas that there's not a lot of data out there. So I just tell patients, let us know, send to me what we're talking about, and we take it from there.
Thank you so much. And I'll be sure to make sure I share that link too. Do you have any final thoughts for our viewers and our attendees today?
Yeah, I think it's a reminder that cancers are, they are tough diagnoses. Even small ones are, have to still go through a lot of hoops to get it cured. I think it's important to keep in mind it's never a person's fault. Is actually the toughest part about cancer, that you can do everything by the book. So then you can never know, well, why did I encounter such a tough diagnosis? However, almost, at least in the breast cancer world, almost all of the cancers are curable. Stage 1, 2, 3 are curable. And, the difference really is just you might have to go through more hoops for a cure with higher stage, but we all end up in the same area. This is a journey that sometimes takes years. When you're talking about, those hormone blocks can take up to 10 years. So, choose your oncologist, choose the place that you're comfortable with, do research, do your research, look up resources, look up what you need to do. And it's hard to say these words to somebody who just gets such a tough diagnosis. People are just all, when they hear these diagnoses, and understandably, but it's still also important. Sometimes I had a patient who told me, I got my, her significant other told him, you do the research, you figure out, you delegate it, right? So at least you delegate, find somebody that can help out. Again, resources are very important. So, you can find a place that can treat it. You can find a place that can treat it, provide you with plastic surgery options, wigs, stuff for neuropathy, things for mental supportive care, like a psychology, a psychiatrist. So resources are important, because that's what can get it through. I do want to quote our cancer director, Dr. Sleckman. He told me with this nice sentence that it matters where you go and get your cancer care. It does matter. It does matter. Not all places would treat it necessarily, even with the same guidelines. And a plug here to clinical trials. All the guidelines are based on research. All the research is basically clinical trials. Everything the patients receive when it comes to treatment is at some point with a clinical trial. So again, clinical trials is how we move the field forwards. So it does matter where people get their cancer care, because of all these different factors. But yeah, that's what I think it's important. I think it's a tough diagnosis. The least that oncologists can do is to make all these resources available for patients so that we can help out.
Thank you so much, Dr. Elkhanany. I'm so glad that you were able to address a good bit. I feel like, again, like we could talk about these myths for a very long time, because there's a lot of stuff on the internet, and there's a lot of chatter in the family about, health and physical health, and specifically related to breast cancer. So thank you so much for lending your expertise and lending your time to talk with us today. And we are just so grateful, and thank you so much for all that you do.
Absolutely. Absolutely. Thank you.